Welcome to the NorthLakes Podcast. Today, behavioral health therapist Jane Moker joins us to talk about trauma. Jane earned her Master of Science in Clinical Psychology from Marquette University in Milwaukee, Wisconsin, and sees patients at our Marinette clinic. Let's meet Jane.
My name is Jane Moker, and I work here at NorthLakes. I'm a mental health therapist here, and I've been here about 5 months or so.
And I think you were just saying you did some work with the county before this. What county was that?
Yes, I worked for Marinette County for 21 years. I did day treatment. I was a day treatment therapist. I also was a in comprehensive community services and was a therapist there, went out in the community and saw people. I've seen lots of people throughout my career that have had trauma.
Oh, so you've seen them all.
I've seen a lot, yes.
And so you tipped my hat a little bit there that today we were going to be talking about trauma. That's why you and I are getting together for the NorthLakes podcast today.
Yes, definitely.
What is trauma?
So trauma is a lasting emotional response that results from a very, very distressing event, usually a dangerous event, something like that. Experiencing a traumatic event can harm a person's sense of safety, their sense of self, and ability to regulate their emotions and navigate their relationships. It's really, really tough.
And what would be an example of a traumatic event?
Some of the more basic ones that people think of is if you're in a car accident, death of a loved one, witnessing somebody having a very significant medical illness. Of course, war is going to war is the most known one, but it can be smaller things too. But it has to evoke that sense of fear and almost feel like your life can be possibly threatened in order for it to be actually a trauma.
So it's something happens and it kind of leaves a little imprint on your brain, or it like something happens to your head that it clicks in and it's locked in there.
It leaves a big imprint on your brain. Actually, changes kind of some of the chemistry. People that have gone through trauma tend to have higher startle responses because their emotions, their adrenaline is higher in the body. Actually, brain scans have shown parts of the brain to look different in people that have been through traumatic experiences.
And so what's the function? Why does this happen, and what's the brain doing to preserve the human that it's part of?
So it's the brain.
If that's the right way to put it, I don't know. I hope you know what I'm trying to
I know what you're saying.
Okay,
yes,
okay,
I'm
good. All right.
It's the brain's way of trying to protect a person when they go through some kind of a traumatic experience, say abuse. And the abuse is kind of happening over and over. The brain provides kind of a buffer. Sometimes a person will actually just kind of almost tune out, kind of like just not even be in the moment and not have memory of the trauma, because their brain kind of shuts things down to protect them and to kind of help them to deal with future events of trauma or abuse or whatever the traumatic event is.
Got it. So it's like, this might happen again, so be ready.
Yes.
Got it. Okay. And so is that in a way, can that be a good thing? I mean, so I guess my question is there, what's the good part of trauma, if there is one?
It's good because it protects the person in the moment of the trauma. The bad thing is once they're kind of not experiencing the trauma event anymore and they're just in their normal day-to-day living, that it's still there, that it's still, it can really, really hinder their everyday functioning because they're so emotionally charged and emotionally dysregulated that they have trouble in relationships, trouble just with simple day-to-day living things. It can really, really be a very big negative effect on regular normal living if the person doesn't go through and kind of isn't able to process that emotion and process the trauma, so that they can get those responses to be less.
Got it. Imagine people are going to experience trauma in different ways. So something that might be traumatic to me or you isn't going to be traumatic to someone else? Or is it the same in everybody?
No, it's definitely different. Everybody's different. There's like, it's kind of unknown, like exactly why it develops in some people and not others. I've read that people that do experience some sort of trauma, only 1 in 3 actually will go on to develop like post-traumatic stress disorder or PTSD. And it's really not known. I mean, 2 people can go through very, very similar trauma, even say a brother and sister, siblings going through the same types of things, witnessing domestic violence or whatever the case may be, or being in a fire or anything like that. And not both of them will end up with PTSD. Some people are fine, are okay, maybe more anxious, but not actually traumatized by the same event.
Boy, I hear that all the time. PTSD, I have PTSD. If you actually have trauma, is that a little traumatic to hear people throwing that around?
I think there's more PTSD out there than most people realize. I think it really is a big thing. A lot of times people will come in for therapy and saying they have X, Y, and Z diagnosis. And really, when after further questioning and really getting in there, you realize that there was some sort of traumatic event or events in their lifetime, that it's really more of trauma response than actually the other diagnoses that they've been given by other people.
That must be... I admire how you do that. Like I talked to another therapist, and I was just amazed like that you kind of have to go through this interview process to kind of figure out what's going on with someone. And then is that a big moment for you when you were like, aha, I think this might be it?
It is definitely for me, because I think it helps when people understand where their symptoms are coming from and why they have the symptoms, and it can be kind of explained. That's a huge, huge, I think, relief for some people. It's not a cure, obviously, but I mean, people come in and they've got these 5 different diagnoses that they've been given. I mean, so they come in thinking they're crazy because they have all these diagnoses thrown at them. None of them really fully fit. And then if you can kind of explain that actually it's this traumatic event or traumatic events that they've went through, I think that's very, very helpful to make that connection for people so they can see, this is why this is happening. This response in your body, this emotional dysregulation, all of this is going on because of what you did or went through in the past.
And do people just have it wasn't that big a deal? Or is there there's hey, squash that down, don't worry about it? Or of course those are probably all examples.
Those are good examples, actually. A lot of people, not everybody, some people really embrace that, but other people will be like, it's in the past, it doesn't affect me. And I'm like, well, it clearly is affecting you. These are your symptoms that you're talking about, and but some people don't want to hear that and don't want to believe that, which is fine. I mean, that's their choice, and they just may not be ready to work on that, or may never be ready to kind of work on processing through the trauma, because processing trauma is hard. It's a lot of work, and it's can be really exhausting for people.
There's a reason it got squashed down.
Yeah. And
put aside.
Oh, for sure.
I'll deal with this later, if at all, or I don't even know what that is anymore.
Right. There's a lot of times people don't even have memory of what the actual trauma is. I mean, they know something has happened to them, or they know people have told them what's happened to them, but they have absolutely no memory of it. So they're like, well, how can it affect me if I don't remember it? Because your body remembers and your brain remembers. You may not have a memory of it, but your body does remember these incidents.
Wow, really? Mm-hmm. And so something similar might happen, and it's why am I really anxious about this? Or how does the brain, I'm guessing, I don't know, you know what I'm asking, I think. Yeah,
it doesn't have to even be something similar. That. This is why it can be debilitating for people. So somebody was abused, say, and then so their startle response is really high. Their emotions are always heightened, much higher than what other people's emotions are. So when they're something smaller happens that's a stressful event that's not trauma, it can put them over the edge. That's that emotional dysregulation that we're talking about. All of a sudden they failed a test, or they got pulled over by a police officer, whatever. Something that regularly for most people without trauma, would be stressful, but you get through it. Where people that have had trauma, some of these littler things in everyday living just is too much for them, and it looks like they're overreacting, But that's because of the changes in the brain that have happened because of the trauma.
And for the person who has had trauma, this is their everyday. That's nothing new. They just it's something they live with and don't think about it. It's just part of them. It's who they are.
It is. And they don't, a lot of times, like I said, when they come in, they don't understand it. Like, why am I so, why are my emotions all over the place? Why are my relationships not great? Why my partner says one little thing and I'm blowing up or I'm really irritable. I'm really angry over little tiny things. Why is this? Well, it's because of the changes in the brain that happen after you've been through trauma for some people.
And what's it like? It must feel so great when you're able to this is it. And kind of show do people feel like a weight off their shoulders?
Some do. Some don't want to hear it. I mean, everybody's different. But at that point, then the next question becomes, do you want to try to work on processing this or do you want to not? Because, like I said, that can be super painful and difficult to go through. I mean, it's scary to go through things that have happened to you or to try to remember the things or to allow those flashbacks to come and not fight them or those intrusive thoughts. It's a lot to deal with. So some people are not ready to process their trauma, and that's perfectly fine. I meet them where they're at. If they're not ready for it, they're not ready for it. We can work on other things for sure. But the people that I have been able to process trauma with, the difference is amazing.
And how are you able to help them? What do you do? How do you help them process the trauma?
Have them tell their story if they're comfortable doing that. Talk about the trauma, talk about the flashbacks, process through those intrusive thoughts and the nightmares and things like that. Just continue to process through all that till there's a change. The flashbacks aren't as bad. The flashbacks are less often. The nightmares are less. The nightmares are not quite as scary. Things like that is what I look for. Just helping them to improve their daily living skills, improve their daily life.
Or at least maybe help them recognize what it is. Here's why, maybe they had no idea, as you said, they come to you I don't know why this is happening. Mm-hmm. And it's got to be helpful when you're able to say this is why it's happening. I mean, that's got to be some relief right there.
Yes, I think so. When putting words to what they're experiencing, because otherwise it's just scary. Yeah,
taking the mystery away.
Yeah. Exactly. Mm-hmm. So I do a lot of psychoeducation with people that I work with trauma and, get them understand the difference between a flashback or intrusive thoughts or the nightmares and why those exist or, things like that and try to help work with them on how to recognize small differences, in the flashbacks or small differences in the nightmares. Maybe even tracking the flashbacks, the nightmares, how often they're coming, how often they're happening, things like that can be helpful because then you might be having 12 in a month or 15 in a month, 1 month, and then 6 months down the road, all of a sudden you're like, oh, I'm really only having 10 in a month. Where if you're not really logging that or monitoring that or paying attention, you're just going to think it's still bad. It's still the same. Where 15 in a month down to 10 in a month is improvement.
Mm-hmm. And would you help them find what brings these things about? I hate to use the word trigger because I'm not a provider, so I don't even know if that's a word I should use, but is that the right way to phrase that?
That's exactly the right way to phrase it. I use trigger a lot.
Okay, good. All right. Yeah.
Yeah.
I'll be, triggers. I do podcasts and therapy. Maybe I'll move into that.
There you go. Good. Triggers is a big thing, recognizing triggers. And triggers are interesting. I mean, sometimes people will not figure out all their triggers. There's just some things you don't know. And they can be from any of the senses. They can be a tactile trigger. They can be it can be a smell. It can be a certain sound. It can be seeing something, which is an obvious one. If you got in a car accident and you get in a car again, you're driving fast in a car, that's a pretty obvious trigger. But yeah, it can be a smell. And then a lot of times if it's a smell or something like that, or just a certain sound, they may not be able to pick that up, what the sound is or what the smell is or things like that.
That has to be tricky. to figure that out? Like, I mean, it's like nobody comes in, like you're not like, you don't like scan a barcode on someone like, oh, this is what happened. It has to be challenging to kind of like be the detective and figure out what happened.
Yeah. And a lot of times you don't figure out all the triggers. I mean, it's not most of the time. I mean, there's going to be triggers there that we don't figure out. We don't know. It's just kind of a process for the person to keep kind of monitoring, keep paying attention and trying to, figure out when those, look around when all of a sudden they're triggered or something happens, what is going on? What are they smelling? What are they seeing? What are they hearing? And they may not figure it out. I mean, they have to still navigate that.
Well, and as you were saying, like to recognize what it is, and then now they have the knowledge at least to look for it and recognize it. And would you, I mean, not everyone's the same, but would you say like, okay, so avoid those, or, like sometimes there's triggers you can't avoid. So how do you help people that way? Yeah,
because there are ones definitely that you can avoid, but then there's other ones, like you said, that you can't. Like driving in a car may not be something you can avoid if you live way out in the country and need to get to doctor's appointments and things like that. Sometimes just working through that and talking through that, and then just having them get in the car and kind of monitor their senses and, teach them coping tools they can use while they're in the car, whether it's breathing techniques or any kind of techniques that are going to ground them into the moment so that their head's not flying all over the place thinking about the trauma that they've experienced, kind of just using mindfulness and any type of coping tools to get them through that. And over time, the hope is that it's going to make it easier and easier, and eventually they'll be able to get in the car without having to do all of those things.
They've learned, I was going to do air quotes there that don't work well for podcasts.
No.
They've learned how to deal with it.
Yeah. Maybe that's once they process through it, a lot. And they might still be anxious in a car, but it might not be as debilitating as it had been at first.
This is all I love talking to behavioral health therapists. I don't know why it is, but I learned so much from you guys. What happens when someone doesn't process this? Like, for one thing, maybe they don't want to, they've come so far to see you. So they're like, no, I'm not going to deal with it. But then there's the people that don't even like come at all, even try to like recognize it. Are there, what happens to those people? What can happen to them? How can this affect them in the long term or short term? It depends
on the person. Everybody's definitely different. There's a lot of people that I see that end up turning to like alcohol or drugs to try to cope with the symptoms. And that, I totally get why they would, to kind of numb those responses down. So you'll see that a lot. A lot of times you'll see people that, have a hard time even like holding a job or, just doing everyday living kind of things, unfortunately. And some people are able to function with their trauma. There's definitely different degrees of trauma or different degrees of how people's reactions to trauma. So yeah, it can be very debilitating to people. And sometimes a lot of those people don't even realize why they're like the way they are.
And it can get stacked up too. It's not like it could be like one incident.
Right. There's sometimes trauma can be like a one-time thing, but then it can also be something that's ongoing, like say childhood abuse, like they're abused over and over and over and over. Or there's other people that have complex trauma where it's several different type of traumatic experiences that they've gone through in their lives. Maybe they've gone through physical abuse, sexual abuse. They were in a car accident, then they were in a fire. Then, so it's numerous different kinds. And then you have complex trauma, which is like trauma exacerbated. Basically, that's really tough to deal with when there's multiple different kind of traumatic events that have happened.
Just another piece of the puzzle you need to try to figure out.
Unraveling an onion.
Ooh, unravel.
Well, peeling.
I'm sorry. And I don't mean to split hairs with you, Jane. So Do you work with other providers when it comes, like when you speak of alcohol and other drugs, you must work with our recovery people, or is that so do you work in tandem with them? Because that's another thing.
Yes, definitely. Oh yeah. We work as a team for sure. And here, the deal with some people that are coming in with trauma and say that they using alcohol or drugs, they aren't always wanting to address that because it's in their minds, it's worked for them for a long time. So it depends on where they're at. Like, I definitely wouldn't refuse to see someone if they're going to continue, using alcohol or drugs. I mean, I'm going to continue to talk about it with them and how that's not a helpful thing to be doing. But yeah, if they agree to being referred to AODA services, then yes, I definitely work as a team with the other provider.
So that, it's a lot of work for a patient if they want to deal with this. If they've kind of like had this set life and they've this is what they're doing, they feel like they were going fine. This one other little thing happened and they come see you and it's gonna, I don't want to say you challenge them, but you're like, hey, here's some we can make your life better this way. It's going to be a little hard.
Yeah, I always tell them it's definitely not an easy thing to go through. Mm-hmm. It's a lot of work.
Right.
And it's a lot of work on their part. I'm not the one doing the work, really. I'm guiding, but they're the ones that are going to have to do the work in between sessions and, monitor and pay attention and things like that.
Oh, it's got to be a tricky road to walk.
Yeah.
Where you maintain that trust and not find that line where you're helping, but you don't want to push too far that you shove them away and they don't come back.
Exactly. And that happens sometimes. Not everybody's ready to deal with their trauma at that particular time. Everybody's on their own path and has their own experiences. So you have to navigate that and allow them to be where they're at if that's what they want.
And I've been around my coworkers, my behavioral health therapist friends, and around it are, like I say, coworkers. But I don't think it's uncommon to say, hey, maybe you and I aren't a good fit. Let's find another provider for you to talk to. Yes,
definitely. I'll have clients, and I'm not trained yet in EMDR, which is a really good, effective therapy to deal with trauma. You can have a few sessions of EMDR and it can be very, very, very helpful for people. So I definitely sometimes will have a client that I'm like, I really think I'll do as much as I can for you. But at the end, if you're not where you want to be, then I would definitely refer to a therapist that is trained in EMDR because I think it's a really pretty amazing therapy for people with trauma.
Another tool in your toolbox, or you have other resources of other providers that different things. And maybe you'll speak with someone and say, you know what, this might be a better fit for you.
Yes. The other thing that I work with too is people that have trauma. A lot of times, getting them in with a psychiatrist or psychiatric nurse practitioner, somebody that specializes in mental health kind of medications. So there's medications out there that can help take the edge off of some of those symptoms, those trauma symptoms that people have. And that can be super helpful. If you can take the edge off a little bit, a lot of times it'll make it easier for them to then go in and process the different things that are going on.
They get into a safer space, a little bit more lax, and it gives them a little more headspace to actually treat what's happening.
Yes, exactly. So definitely you got to work, on board with whoever the prescriber is for sure. And sometimes people come in and they're just going to a primary care doc. And I'm like, I think a psychiatrist would be a better fit for you because, you have all this going on and, nothing against primary care providers for sure. But, sometimes with people with especially complex PTSD, they need somebody that's an expert in this particular thing.
Well, just like they would need for cancer or name another disease. You know, like a primary care, they're the first ones, and then they can show you the path to something else.
Yeah, of course.
Yeah.
And I've not had issues any of the primary care physicians that I've worked with that I've referred somebody to psychiatry, I've never had them say, hey, why did you, they're always very, very supportive of that.
That's got to be, I know I like collaborating in my workplace, my work environment. That must be really wonderful to have those collaborators.
Definitely. It's huge. It's key to working with patients with trauma. you have to, be collaborating with all the different providers that there are, and hopefully getting even natural supports on board, friends, family members that are supportive of them, get them on board and even kind of talk with them about how they can help as long as the person's okay with that. Those are all really, really important things to work with a person. You can't just pluck the person and work with the person and fix them, quote unquote, air quotes again.
Yeah, right. We should have a little sound.
Yeah.
Maybe like ding, that means air quote. Yeah. I derailed your thought there. Sorry.
Oh, you're fine.
Was trying to be funny. It's not like somebody comes in and like, oh, PTSD or trauma. Here, this is what we will do. This is what we do for trauma.
No, it's not like that at all.
Yeah.
It's definitely like I said, it depends on where the person's at, what they want.
And you mentioned that you'd been at this for years, for a long time. It must be like so as time has gone on, you've learned how to do this better and better. I mean, I'm sure, and there's always new techniques, but how's it changed, like, for you, like, personally? Like, I'm digging a little deeper maybe than you want me to, but I'm like, what's it like being like maybe a provider, like a therapist your first year compared to where you're at now?
So different.
Uh-huh.
I think the biggest difference for me is I was so unsure of myself then, and really kept thinking about the books that I read in graduate school, think about the textbooks, where over the years I had to learn, like, I can't just be thinking back on the textbook. I have to use the skills that I have in myself as well as what I've learned. And once I started doing that and started working with people and started seeing success in clients, and became less afraid. People come in with a diagnosis, and a lot of times I think clinicians are like, or therapists are like, "Ooh, I've never dealt with that before. That's whatever." And I'm like, bring it on. Now I'm like, bring it on. I'll order some books. I'll collaborate with some of my, other therapists that have dealt with this situation, or I'll just be curious and ask the person, what is that like? Tell me about it. Tell me about where you're at with that. Tell me, explain this to me. And I think that's huge, letting them tell their story and just being curious and saying, I didn't know that. I don't know about that. Let me look into that for you. Mm-hmm. Being okay to be vulnerable and be like, I don't know everything. I'm not always going to be perfect as a therapist. I'm going to mess things up sometimes. But if we can have a conversation about that, we can definitely both move forward with your treatment.
And do you collaborate with other therapists that are maybe new at it and like talk about what they're going through and help them along a little bit?
Yes, we meet weekly with a group of us therapists. We meet weekly and have meetings and stuff like that. So yeah, sometimes they'll have questions and things like that. And yeah, I'm all for throwing out my ideas or, giving them resources or different things like that.
Oh, that's got to be, I hate to use the word fun, but that's got to be really satisfying to be able to help your coworker, work with your coworkers that way.
Yeah, definitely. It is.
Okay. Another trauma question, and I don't think I prepped you for this one. How does it affect children differently?
Wouldn't say, well, I guess a little bit differently in that children, their brains are still developing. So when you're a child and your brain is not fully developed yet, it changes the way your brain is. I mean, it changes, how your brain works. So I feel like trauma in childhood, especially, if they've experienced trauma after trauma after trauma, can definitely be very debilitating for people. Not that adults going through trauma isn't debilitating, but for a kid who's going through something and doesn't feel safe growing up, and it very much affects them a lot, probably more than adults. And then it's really hard for the adults that are caretakers of these kids to understand some of the behaviors that go along with somebody that's gone through trauma.
Well, I mean, kids, they're learning everything right then. So if their brain has taught them that,
yes,
that's what their brain is doing.
Exactly. And one example of that is kids that kind of were neglected and didn't have enough food, right? Well, then what they learn is whenever they get food, they collect it and they keep it, and because they're so used to their body going without food that their brain is saying, if there's food in front of you, eat all of it, you keep all of it, you put it in your pockets, you bring it to your bedroom, and so I'll have caregivers or parents come and say like, well, they're still hoarding food in the room, and I'll say, yeah, that they are, but that's okay because that's what their brain is telling them to do. You know what I mean? They're not misbehaving. That's what their brain has taught them to do to survive. And
that I would not have thought of that example. And so how do you do you try to fix that? I don't know. That's sounds mean to put it that way. But I think that's maybe when I was growing up, that's what you do is if you fix that behavior, not fix, but don't do that anymore. And so another layer of trauma, I guess.
That's re-traumatizing, which is then which is why I work with parents when I work with kids with trauma, it's always a requirement that I'm working with the parents too, because they're the ones at home with the kids and dealing with the kids and supporting the kids every day. So they need to learn techniques and have support in how to do that best. So if they're giving consequences to a kid for taking food in his room, that's just re-traumatizing to that child. And if I can get them to understand, this is a normal behavior for a child that's been through what your child has been through. So if you can kind of let that go and not focus on that behavior and focus on some other things instead, just normalize it for them. This is normal behavior for a kid that's been through what your child has been through. It's okay. They're not misbehaving. This is instinctual.
What a relief for them.
It can be.
Understanding. So they're why are they doing, what's happening? Why are they doing this? And to be able to explain it, that must be very helpful.
Definitely. And some don't want to hear it. Some still think it's behavioral. I know it's behavioral. And I'm like, no, it's your kid is doing the best they can with what they have.
So if someone, you already explained to me that trauma affects people in different ways.
Yes. So
somebody that's two different people that have been in a car accident, maybe the same car accident, they're going to go about it different ways.
Yes.
What would you suggest to someone that they do look into it? Maybe you do need some help with trauma or what happened, because as you said, some people are going to go through that and it doesn't affect them. Or does it? Or they are able to process it on their own? I guess at what point should someone seek out therapy, seek out help?
I think if it's affecting their relationships, it's affecting their day-to-day living. I mean, if they're say avoiding getting in cars or won't, things like that, and it's affecting their day-to-day functioning, that's when they should definitely seek out therapy. If it's not really affecting them that much, or if it's just a little anxiety here or there, then they can generally process that on their own. But yeah, if it's affecting their daily living, for sure seek out therapy.
Their quality of life isn't what it could be.
Exactly. Yeah. I mean, relationships can get rocky, things like that. If you have an exaggerated startle response, or you're, irritable or crabby or angry, I mean, obviously that's going to affect your relationships.
Mm-hmm. But it isn't weird to think that somebody could go through that and process it on their own and go on living just fine.
No, a lot of people do.
Mm-hmm. But there's also maybe it was fine at the moment, but so many years or whatever down the line, it kind of rears its head again. Does that happen?
Yeah, that actually can happen. And sometimes it's just some little trigger that kind of brings it back up, or something just really obscure. But yeah, a lot of times people are I didn't think that bothered me. It didn't bother me then, but all of a sudden now it's something's really upsetting me. I'm really having a hard time, my day-to-day living. And then you start exploring and going back and finding out, there was a car accident. There was whatever. There was a fire. There was whatever it was. And they just, went and saw fireworks, all this or whatever, and it brought all that back up for whatever reason.
Mm-hmm. And I'm guessing again, maybe the body's ready, okay, now the brain's saying I'm ready to deal with this now.
Right.
Or now I need to deal with this.
Right. Yeah. Because some people suppress things too, like we talked about before. You can suppress those things and suppress them until you can't. I mean, and stuff starts coming up and coming up and coming up, little by little. And then all of a sudden the person's like, what's going on?
So talk a little bit about PTSD, post-traumatic stress disorder. We touched on it when we just first started talking, but is it worth talking a little bit more about that? Is that different than just straight up trauma?
People can have trauma and not end up with PTSD. PTSD, again, is something that's affecting your daily living, your relationships, all of those types of things. Sometimes it's affecting whether you can hold a job, whether you can provide for yourself financially, your relationships, your relationships with anybody, your spouse, your children, parents, all of those things. So you can experience trauma and not have PTSD.
But what is it? So like post-traumatic, like it just shows up, post-traumatic means it just shows up later, or? No,
not necessarily. It can show up right after. It's just, post in this case just means after the trauma. So it could be the day of the trauma. I mean, so no, people experience the trauma and then it's affecting them, their day-to-day life.
It's is it a fancy phrase for trauma?
No, because like I said, you can go through trauma and not necessarily have PTSD, because you can go through trauma and it doesn't affect your day-to-day life. Your relationships are okay. You're able to provide for yourself. You're able to hold a job. You know what I mean? You're functioning okay. But it's when people cannot function in some of those areas of their life that then they would warrant a diagnosis of PTSD.
Got it. Thank you. Because I mean, you would agree with me. I think that gets thrown out quite a bit, that it's out there. So it's helpful to break it down a little bit. So thank you.
Yeah, it does. It gets thrown out a lot.
Okay. I know I got one more question for you, if you don't mind, unless there's anything else you'd like to cover.
No, I'm good.
Okay. My last question is, what's in your car right now?
What's in my car right now? Lot of junk? No. I have all these shopping bags in the back. I have a couple of cups that my kids left in there that I have to take out and throw away. I have makeup in there. Oh, I have lots of things in my car.
Jane Moker, thank you so much for being in here and talking to me about trauma. I've learned a lot, and it was really nice to talk to you. Thank you.
All right. Thank you for having me.
Have fun at the fair.
Oh, thanks. I'll try.
Okay. All right. Have a good day.
All right. You too.
Bye.
Bye.
Jane Moker is a behavioral health therapist at our Marinette clinic. She sees patients in person and virtually. Thanks for all the information, Jane. It was great to talk to you. If you think you could benefit from speaking with someone about some trauma you may have experienced, give NorthLakes a call at 888-834-4551. NorthLakes Community Clinic is a community health center with several clinics located throughout the northern part of Wisconsin. Our mission is to respond to the healthcare needs of our communities with an integrated array of quality services and actively remove barriers to wellness. My name is Jeremy Oswald, and I'm lucky enough to have these conversations here on the NorthLakes Podcast. Leave us a review wherever you listen. It's always great to hear your feedback to let us know what you're thinking. Thanks for listening, and join us again next month when I'll talk to another one of our NorthLakes providers.